Hi guys, so I'm going to be talking about the condition cerebral palsy, short for CP. So CP is a group of disorders that affect the person's ability to move and maintain balance and posture. CP is the most common motor disability in childhood. Cerebral means having to do with the brain. Palsy means weakness of problems with using the muscles. CP is caused by abnormal brain development or damage to the developing brain that affects a person's ability to control his or her muscles. The symptoms of CP vary from person to person. Someone who has severe CP might need to use special equipment to be able to walk, or they might not be able to walk at all. And then someone with mild CP might walk a little awkwardly, but might not need any special help. CP does not get worse over time, though the exact symptoms can change over a person's lifetime. Many also have related conditions such as intellectual disabilities, seizures, problems with vision, hearing, or speech. So there are four main types of CP. Doctors classify CP according to the main type of movement disorder that is involved. This depends on which area of the brain is affected. The first type is spastic CP. This is the most common type of CP, affecting about 80% of people with CP. People with spastic CP have increased muscle tone, which means their muscles are stiff, and as a result, their movements can be awkward. Spastic CP usually is described by what parts of the body are affected. So spastic diplegia is a type of CP where muscle stiffness is mainly in the legs, with the arms less affected or not affected at all. People with spastic diplegia might have difficulty walking because of tight hips and leg muscles, causing their legs to pull together, turn inward, and cross at the knee, which is known as scissoring. Spastic hemiplegia is a type of CP that affects only one side of a person's body. Usually the arm is more affected than the legs. And spastic quadriplegia is the most severe form of spastic CP, and it affects all four limbs, the trunk, and the face. People with spastic quadriplegia usually cannot walk and often have other development disabilities. So type 2 of CP is dyskinetic. People with dyskinetic CP have problems controlling the movement of their hands, arms, feet, and legs, which makes it difficult to sit and walk. The movements are uncontrollable and can be slower, rapid, or jerky. Sometimes the face and tongue are affected, and the person will have a hard time sucking, swallowing, and talking. A person with dyskinetic CP has muscle tone that can change, varying from tight to loose, not only from day to day, but even in a singular day. The third kind is ataxic CP, which is where people have problems with balance and coordination. They might be unsteady when they walk. They might have a hard time with quick movements or movements that need a lot of control, such as writing. They might also have a hard time controlling their hands or arms when they go to reach for something. And the last type is mixed CP. This is when they have more than one of the symptoms. The most common type of mixed CP is spastic dyskinetic CP. So what causes CP? It's caused by damage or abnormal development in the parts of the brain that control movement. These events can happen before, during, or shortly after birth, or within the first few years of life when the brain is still developing. In many cases, the exact cause of CP is not known. The majority of children with CP were born with the condition, which is a situation called congenital CP. So these causes can be damage to the white matter of the brain. The brain's white matter sends signals throughout the brain and the rest of the body. Damage to the white matter can disrupt the signals between the brain and the body that control movement. The white matter in fetus's brain is more sensitive to injury between 26 weeks and 36 weeks of pregnancy, but the damage can happen anytime during pregnancy. Another cause can be abnormal brain development, which is disruptions in the normal growth process of the brain that can cause abnormalities. These abnormalities affect the transmission of brain signals. Infections, fever, trauma, or gene changes can cause the brain to develop abnormally. Another cause is bleeding in the brain. So a fetus can have a stroke, which is a common cause of brain bleeding. Strokes occur when blood vessels in the brain become blocked or broken, leading to brain damage. Conditions including blood clotting problems, Abnormally formed blood vessels, heart defects, and sickle cell disease can also cause bleeding in the brain. And another cause is lack of oxygen in the brain. The brain can become damaged if it does not get enough oxygen for a long time. Very low blood pressure in the mother, a torn uterus, detachment of the placenta, problems with the umbilical cord, or severe trauma to the infant's head during labor and delivery can prevent oxygen from getting to their brain. A small number of children have what is called acquired CP, which means the disorder begins more than 28 days after birth. And this can be acquired through brain damage in the first few months or years of life, infections such as meningitis, problems with blood flow to the brain due to a stroke, blood clotting problems, abnormal blood vessels, a heart defect that was present at birth, or sickle cell disease, as well as head injury from a car accident, a fall, or child abuse. Some early signs that you can see for CP are in a baby younger than 6 months of age, their head lags when you pick them up when they're lying on their back. They feel stiff, they feel floppy, and when they are cradled in your arms, they seem to overextend their back and neck, constantly acting if they are pushing away from you. And when you pick them up, their legs get stiff and they cross or scissor. So for a baby older than 6 months, some signs are they don't roll over in either direction. They cannot bring their hands together. They have difficulty bringing their hands to their mouth, and they reach out with only one hand while keeping the other hand fisted. For a baby older than 10 months of age, some signs is they crawl lopsided, pushing up with one hand and one leg while the other arm and leg just drag. Or they scoot around on their butt or hop on their knees, but they do not crawl on all fours. Some benefits of exercise for CP. So your muscular fitness, cardiorespiratory fitness, as well as your full joint range of motion can be achieved through regular exercise for individuals with CP. So increasing these levels are associated with improved functional capacity and mobility, reduced risk of depression and improved quality of life, maintaining healthy weight, reduced risk of osteoporosis, lower incidence of type 2 diabetes, reduced risk of fall and related injury, reduced back pain, lower risk of hypertension, cardiovascular disease, stroke, and heart attack. So in order to acquire these personal benefits, an effective and safe exercise prescription needs to be created. According to the American College of Sports Medicine, the same guidelines proposed to the general population can be applied to individuals with CP. However, due to the impact that CP has on neuromotor function, there will need to be modifications and considerations to keep in mind. Diagnosis of CP. Most children with CP are diagnosed during the first 2 years of life, but symptoms are, if symptoms are mild, a healthcare provider may not be able to make a diagnosis before the age of 4 or 5. So during the child's visits to the doctor will examine growth and development, muscle tone, control of movement, hearing and vision, posture, coordination, and balance. And if this healthcare provider were to see signs of CP during the examination, they will do one or more brain scanning methods to look for the damage in the brain. These methods include an ultrasound, which is a method used most commonly in high-risk preterm infants to take pictures of the brain. An ultrasound is not as good as other methods at taking pictures of the brain, but it is the safest way for a preterm infant. Another way is through a CAT scan, which uses X-rays to take pictures of the brain and can show the areas that are damaged. Another way is through an MRI. It uses a computer, a magnetic field, and radio waves to create an image of the brain. It can show the location and the type of damage in better detail than a CAT scan. And another way is with an EEG. So if a child has seizures, the healthcare provider may order this test to rule out another disorder such as epilepsy. Small discs called electrodes are placed on the scalp to measure the brain's activity. So the effects of exercise of CP on the exercise response. So individuals with CP may have to start at a lower level and slowly increase the amount of time or intensity of the exercise. You may need to modify the activity to meet your individual's needs and physical abilities. Some exercises may not be possible at all for them to do, depending on the severity of their CP. Aerobic training for individuals with CP can improve the physiological outcomes. Stretching exercises is a common and great treatment for spasticity. Some management and medications for individuals with CP. So children and adults with CP may require lifelong care with a medical care team. Besides a pediatrician or a physical medicine and rehabilitation specialist, and possibly a pediatric neurologist to oversee the individual's medical care. A team might include a variety of therapists and mental health specialists. These experts give special attention to needs and issues that are more common in people with CP, and they can work together with your primary care provider and together develop a good treatment plan. There is no cure for CP. However, there are many treatment options that may improve daily functioning. So some treatment options can include medications, therapies, surgical procedures, and other treatments as needed. Medications can lessen muscle tightness, might be used to improve functional abilities, treat pain, and manage complications related to the spasticity or the other CP symptoms. One kind is muscle or nerve injections. This treats tightening of a specific muscle. Your doctor might recommend injections of a Botox or another agent. This injection will need to be repeated about every 3 months. Some side effects can include pain at the injection site and mild flu-like symptoms, and some other serious ones are difficulty breathing and swallowing. Another medication is oral muscle relaxants, such as a drug as baclofen, are often used to relax muscles. Medications to reduce drooling. An option is Botox injections into the salivary glands. A variety of therapies also can be done for treating CP. Physical therapy will help with muscle training and exercises to help the individual's strength, flexibility, balance, motor development, and mobility. An occupational therapist will work to help the individual gain independence in daily activities, routines at home and school, and in the community. Adaptive equipment recommended for the individual can include walkers, wide base cones, standing and seated systems, or electric wheelchairs. For the first 1 to 2 years after